Hi, I am Lindsay and I am a student dietitian, and today I'm going to talk to you a little bit about a newly prescribed medication that you're taking called Warfarin, or it's also called Coumadin. You may hear me use those interchangeably, just know that they're the same thing. So we'll talk a little bit about that and some things to look out for in your diet that may interact with the medication. So I'll just briefly kind of go over what Warfarin is. I'm sure maybe your doctor might have talked to you a little bit about that. So Warfarin is an anticoagulant. A lot of people call it blood thinners, and that's plainly what it does. It's thinning the blood. It is also reducing your instance of having a stroke or a blood clot. Your doctor may have talked to you about going to get blood work done every couple of months. And basically they're looking for how well the warfarin is working in your body. There are two blood levels called PT and INR. And usually they want to keep those levels in a tight range because whether they're too high or too low, it's either meaning that your risk of blood clotting is a lot higher or you're bleeding too much. So it's very important for them to check these routinely and make sure that they're in range. A lot of different things can cause these levels to fluctuate, and it can include things like alcohol, some dietary and herbal supplements, and some medications. But the big thing that we really concentrate on is vitamin K in the diet. Vitamin K is really going to change these PT and INR levels in the blood. So before I talk about that, just very important to make sure that you're taking your warfarin as prescribed and consistently there. You're going to get checked regularly for your blood work and everything like that. And a long time ago, doctors used to tell their patients to completely stay away from vitamin K foods, which the majority of those are green leafy vegetables. However, later down the line, they found that as long as you're keeping the vitamin K foods that you're eating consistent, you're in the same amounts and every day, then it really doesn't have an effect. Instead of wiping it out completely, and then you're missing out on all those good nutrients and stuff like that. So let me give you an example. Let's say you eat half a cup of vitamin K foods daily, so green leafy vegetables. You want to keep doing that every day in the same amounts. Try not to eat something consistently and then just stop cold turkey and quit taking it. Same thing with, like, maybe not an amount, but let's say you eat a spinach salad every day. Don't just stop taking it. Don't just stop eating it, rather. So I'll give you some paperwork right here, but I have a list of foods that are high in vitamin K, and it also shows the amount. Again, you don't have to limit your vitamin K, but it just gives you a good idea of how like the ones at the top of this list are really high. Rather, the ones at the bottom of the list are fairly low. So like I said, green leafy vegetables are going to be probably your highest vitamin K foods. There are some foods on the other side of the page that are lower in vitamin K. Again, just good to be aware of those. Even things like blueberry and blackberries really don't have much vitamin K at the serving size of like half a cup. However, if you eat blueberries or blackberries in excess, that may be a problem. So some of the main ones here are going to be kale, spinach, any type of greens like mustard greens, collard greens, turnip greens are high in vitamin K. Also, Brussels sprouts, broccoli, and cabbage. And yeah, that's pretty much it. You'll see some of these foods are higher in vitamin K if they're cooked, and some are higher in vitamin K when they're raw. So you'll just have this to refer to just to get a good idea of how much vitamin K you're getting and keeping that consistent. You know, you can have different types of foods at however much you want to eat, but just keep the amount consistent. Let's see. Some other things to look at that aren't necessarily high in vitamin K but actually interact with the medication a different way is cranberry juice, or eating cranberries. I'm not sure if you do that. You know, an 8-ounce glass of cranberry juice is fine. Just avoid eating or drinking excessive amounts of cranberry juice. And grapefruit juice or grapefruit, that is a common food drug interaction with many medications. So a lot of people tend to stay away from it completely, but try to avoid that when taking warfarin. Alcohol should be avoided. Talk to your doctor if you have any questions about that, but that is going to thin the blood too, which can interact with how the warfarin's working in the body. And some dietary and herbal supplements. Not sure if you are taking any of those at the moment, but if you are and you haven't told your doctor already, make sure you tell him or her. And then if you're thinking about taking any dietary herbal supplements, or even some vitamin and mineral supplements, let your doctor know before you take them. Definitely don't take anything and let him know later. You know, he may have to adjust your dosage of warfarin. So just constantly staying in constant communication with your doctor is really important. Even herbal teas, think about that too. Liquid nutritional supplements like Boost or Ensure or Glucerna are generally low in vitamin K. You know, if you're drinking 1 or 2 a day, it might not be so bad, but if you're having to drink several throughout the day to meet your nutritional needs, let your doctor know. There are a few medications that interact with warfarin. One of those being an over-the-counter anticoagulant. You also might see it labeled as an NSAID, like Tylenol or ibuprofen. So just make sure you are talking to your doctor if you take those when you need to for pain or arthritis or anything like that. Medications for depression or anxiety can interact with warfarin, as well as steroids or antibiotics. So just ask your doctor, even your pharmacist, before starting to take any of these medications. All right, so that's pretty much it. I'm gonna leave this list with you. Just if you remember anything from what I'm talking to you about, keep your vitamin K foods consistent. Try to eat them every day. If you don't eat any of the foods on that list, then just keep doing that. Be careful with alcohol, be careful with starting new medications, herbal supplements, dietary supplements, vitamins and minerals. Anything new out of the ordinary that you're putting in your body, please let your doctor know. Get your blood work done routinely and take your medication often. All right, thank you.